Welcome to Provincial Attachment System information webinar. Today's webinar is going to focus on accepting new patients and specifically around panels inside of the Provincial Attachment System. And the intent of this and audience for this today is all y'all. It is for our MOAs, our clinic managers, our attachment coordinators, PCN managers, and other Provincial Attachment System users. So really a deep dive into those two facets of the system. I am very grateful and to be joining you today here from the traditional and unceded territories of the Indigenous nations throughout British Columbia. And I am specifically speaking to you from the ancestral and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. Welcome you to take a moment to reflect on where you too join us across this beautiful province of British Columbia and these lands. Again, we talked about who the audience is today. Just want to welcome you here and thank you so much for taking the time to do this. It's a tight, packed hour, but we will have you out of here within the hour. And so again, thank you for making the time. I hope you're enjoying your lunch or whatever it is you can do on the side there while we entertain you about the Provincial Attachment System. Just a little bit more of a deep dive around what we're going to do. We're going to do a quick agenda here, some introductions. We are going to talk about accepting new patients. I'm going to set some of the stage for some of these pieces so far as like the processes and the people are concerned. And then Tara will go into the demos and we're going to do that through accepting new patients. And then as well, panel management within the Provincial Attachment System. And then of course, we'll end with a summary of the resources that are available to you, including our fantastic past support team. And then we'll move into some questions and answers to finish up. Before I get too deep into the next agenda item, I will introduce myself. My name is Brandy Strachan. I'm the Executive Director of the Provincial Attachment System. And joining me today is Tara Macklin-Smith, who is our Training Manager for the Provincial Attachment System. And you'll hear from both of us today as we go back and forth between some of those process people and then again, as mentioned, the demo. Couple of housekeeping pieces, as mentioned at the outset, if you were here with us, but as a reminder, we are recording because we make the recording available to you in the days that follow when we finish up today. There will be a Q&A at the end, so please use that Q&A button to ask your questions, and then Tara at the end will fire through those with us with all the answers that you're looking for. And then we'll also be sharing resources within the presentation today, but also as a follow to this session is going to be a bunch of resources that we're going to send out as well, including the presentation that we have today. All right. The Provincial Attachment System is here to help us coordinate and create a seamless approach to connecting patients with a family doctor or nurse practitioner. The system was created in partnership with ourselves here at Administrative Health, Doctors of BC, and Nurse Practitioners of BC. And in addition to the attachment approach to this as well, it's also helping us understand the system, the capacity, where primary care services are needed and how those are being delivered across BC. And it is one of the strategic deliverables of the primary care strategy that launched in 2018. The insights to date have been fantastic. Our ability to accelerate attachment has been fantastic. Lots of learning already and lots of learning to go around the Provincial Attachment System and what we now know about primary care in BC and really making the connection between patients and their longitudinal provider and that relationship for healthful living. I'm going to talk a bit about accepting new patients. This is one of the two main topics of today's webinar. And I'm going to flash up here on the screen the heartbeat of attachment, if you will, so far as when it comes to the Provincial Attachment System. And I often refer to this slide as sort of the happy path of I've put my hand up on the Health Connect registry to say I'm interested in attachment to an NP or an FP, all the way through to I am a provider and I have capacity and us helping make that relationship using the system, a digitally enabled system. So ultimately, if we kind of follow this happy path from start to finish, that's exactly it. Is we've got a patient who would like to be attached. They can do that online at HealthLink BC for the Health Connect registry, or by calling 811, and we'll talk about that a bit. And we have an FP or NP who has indicated that they have capacity to take on new patients. And ultimately, the system allows attachment coordinators, and we'll talk about that great team in a second here, to make that match, to understand, if you will, the demand and the supply of those two facets, and make that connection digitally in the system through the Provincial Attachment System. The ability to send patients to a provider to consider, ultimately for their selection within the system to move into intake. The intake, as it happens as in each clinic, it is slightly different. It is based on that clinic and their provider. And then ultimately to confirm that that is an attached relationship by using the zero fee attachment fee code, which updates the provincial attachment system so far as the provider's panel is concerned, but also that patient gets to know along the way where they're at in this journey through email communications, as well as when they've been attached. So just helping out with some of those more administrative pieces that maybe previously were done with, local wait lists, Excel spreadsheets, all of that good stuff, phoning and calling, and trying to do as much as we can with the system and the digital enablement. And really the bulk of the citizens in British Columbia who are looking for that digital engagement to achieve this end. Next slide. Couple of teams I mentioned that I just wanted to highlight here because we are here for you in this collective system. So 811 is Health Link BC 811, where I have the pleasure of working and where the Provincial Attachment System is grounded. This is the group of folks that work 24/7 to answer calls from anyone in British Columbia. And the purposes for the Health Connect registry is twofold with this team. One, they can help folks register or update their registration or answer questions about their registration in the process. But the added benefit to this team, our care team here at 811, is that during those conversations, or when it's brought up during those conversations, they can also talk to folks about what they might need today. We know when you register to be attached, it's probably not tomorrow that you're going to get attached, but there are many services available to folks, including 811 itself, and our virtual care team, the nurses, dietitians, exercise professionals, pharmacists, and even our physicians that can help folks out in the interim. We can also point folks to the resources that are available in their primary care network and our own HealthLink BC website that offers a lot of that information. The other team to just mention here is the Health Connect registry folks. These are the team, again, working in HealthLink BC that are responsible for the data integrity of the system. So they're the ones who are making sure that email is accurate about the patient. We know what we need to know. If we're missing something in a registration, they're reaching out. They merge the wait list from communities into HCR. We also have, as part of that team, provincial attachment coordinators. This is a small group of attachment coordinators that work at the provincial level, and they're really here just to support the community attachment coordinators in any way we can. That includes opportunities to help them out when there's a gap or a surge in resources, something new and exciting is happening in the community, and they need a few more hands on deck. The other team I'll mention as well is the community attachment coordinators. There's probably a few of you on the call today. Heyo, nice to see you here. But this is the team that the clinics, the providers, that the MOAs, all of those folks you are actually working with. These are the ones who live and work in the community they support. They are across British Columbia, and they utilize the information on the Health Connect registry and what we make available from the panel registry and the clinic and provider registry, the Provincial Attachment System, to make that connection between the patient and the provider. And they work through the local division of family practice and the primary care network set up there. And they're the ones who you would be chatting with, who'd be reaching out, really supporting where there's capacity to attach, but also just understanding the provincial attachment system and making sure that what you might need in a clinic and or patients might need for attachment, we're making those connections, and they're informing what happens with the provincial attachment system writ large, so it continues to evolve to meet the needs in the communities. One of the key things that the attachment coordinators do for you in the community and for us here at the Provincial Attachment System is help with the prioritization of registrants. So these are the folks who, when you register for the Health Connect registry, you put up your hand to be attached. In addition to collecting your demographic information and a few preferences about your attachment, we also ask two health questions. One is about your health stability, and the other one is about health diagnoses. So have you been recently diagnosed? Your health stability, have you recently been in hospital or at risk of readmission, and really dips into that social determinants of health area. And that's as asked through the registration as provided by the patient. So the the attachment coordinators use the information collected by that patient, as well as the health questions, or including the health questions. And behind the scenes in the attachment interface, they couple that with the health complexity. And I'll talk about that a bit more, but that's really using clinical administrative data to understand the patient better. Couple that with the time a patient's been on the registry, and those are the three factors that inform prioritization. We understand that providers need to build a balanced panel for them that works for them, their clinic, and their style of practice. But we also appreciate that some patients need to be attached sooner. So the idea of the prioritization and why there is this questions plus complexity plus time is really to give the latitude in that community, the relationship between the attachment coordinator and that clinic and provider, to understand the breadth of patients that they might be able to accept, and ensure that we're sending over those folks who are high, medium, and low, that combination to ensure a balanced panel, while also ensuring those that need to be prioritized, we're aware from the information we have about them, but that they can be attached sooner. Just really specifically calling out that complexity piece, this high, medium, and low that I mentioned. This is based on two factors: adjusted clinical groups. So this is based on information collected by Ministry of Health through MSP billing. So the diagnosis is the intensity, information about how you have about you and what that patient is experiencing, coupled with the resource utilization bands. And this is the categories where we aggregate how often people are accessing the system. So, the more complex my clinical group, the more I'm accessing the system, might imply that I've got a higher complexity condition or conditions, and I would therefore probably benefit from attachment sooner to keep me in that longitudinal healthful living, and hopefully decrease my utilization of acute services, because I'm getting that attached ongoing care that I require. And the equation is really equals out to a high, medium, and low. And it's that combination of high, medium, and low that we try to always provide when we're referring over to providers to select patients. Again, recognizing that those high complexity patients will require more time of a provider. So how do we find that balance by also attaching a few low at the same time, or a family at the same time? Because often they're not all of the same complexity, so you naturally get that balance. And that's the magical work that the attachment coordinators do through relationships with you all. And then I just wanted to speak about this, and then I think we go into the demo here next, is just around the attachment coordination overview, the experience from the kind of talked about the patient persona perspective. Now let's look at the clinic provider persona. So really the steps in here, which include doing attachment through the Provincial Attachment System, is a provider indicates they have capacity to attach. Either you've been delegated to do so, the provider's done that directly, the attachment coordinator's done that on your behalf through conversations. And with that capacity, then the attachment coordinator understands, this doctor can accept X number of patients. Those patients are then sent to you from the attachment coordinator. So again, that combination of high, medium, low, understanding that provider clinic, if you're looking for particular types of patients to build out the practice that you're looking for. And you would review those patients within the Provincial Attachment System. And we set a 2-week benchmark for that initial review. This is really you looking at that list to determine, am I going to move these patients over to contact them for intake? And that 2-week benchmark is particularly important because while you are looking, or the provider or your clinic is looking at the patients here, they're not being forwarded to any other provider for consideration. So we want to make sure we keep this timeline short. And when we can't meet the 2-week benchmark, happy to pull those patients back, refer them somewhere else, and catch up with you again when you've got time to look at the list. Once we've selected those patients, from selection, they move over to intake. This is where there's about a 2-month benchmark to complete intake. All clinics and providers do this slightly different. How long that intake is different for each of you. So we've given about that 2-month benchmark. A patient is notified that they're moving over to intake, so they know they're going to hear from you in the coming weeks, is our language. And so we leave it really with you around that intake. Again, just honoring that each provider and clinic may have their own processes. Assuming that's successful, zero fee attachment code is either put in place and or you update PAS to say attached. That a patient is ultimately attached to the provider, and they again get notified. Fantastic news, you've been attached from here on in. Health Connect registry, we're over here if you ever need us again, but from here on in, you'll be working directly with that clinic. And so those are the steps, as well as when the patient's notified, the steps of the clinic. But let's hand it over to Tara to show you in real 3D a demo of what this looks like directly in the system and a few other things. Over to you, Tara.
Awesome. Thanks, Brandy. As Brandy introduced, my name is Tara Macklin-Smith, and I'm the training manager for the Provincial Attachment System. We're going to be going through two sets of demos today. Our first set, as we mentioned, is accepting new patients via the Provincial Attachment System. So there's a couple of things we're going to be taking a look at. First, we're going to go through how your provider can designate you as a panel manager. This is required in order for you to both review pending attachments as well as the panel management that we'll be going through later today. We're going to go through provider capacity information and how to update that in the Provincial Attachment System. And then we're going to go through that flow that Brandy just spoke to on the previous slide. So how patients move from the very beginning, which is pending selection, to accepted. We'll go through what data is available and where in the process. We're going to talk about how you can transfer potential attachments from one provider in your clinic to another, if they might be a better match. And then we'll finish that off with how you can add those accepted patients to the provider's panel. As I go through this process, I'm also going to be showing what email the patient receives as they move through that process. Now, before I open up the platform, I do want to chat about panel capacity, and we're going to chat about this again. But what I want to go through is how this is calculated and what is utilized. So to get us started, on the top left-hand side here is my panel size. So this is the number of people that are currently on this provider's panel. Generally speaking, this is based on them submitting that $0 fee code. But basically, if they're on their panel in past, they're going to contribute to my panel size. Now, there are two fields that are actually entered by the provider or the panel manager. The first is desired panel size, which is how many people I want on my panel. Once I reach that, I'm no longer accepting patients. If your provider has an attachment target, that's probably what you would enter in desired panel size. But even providers without that target, basically this is telling us how many patients you would like on your panel. A calculation of how many people you currently have on your panel and how many people you would desire helps us calculate what we call future capacity. And this is your total future capacity for all time until your desired panel size is reached. The other information that's entered by the provider or panel manager is the monthly capacity rate. So this is about how many patients this provider would be able to accept this month. So for example, if your provider only has 6 intake appointments available every month, the monthly capacity rate is probably going to be pretty close to 6. Now, when you enter desired panel size and monthly capacity rate, that creates what we call current capacity. Now, this tells the attachment coordinator how many potential attachments you may still be able to accept this month. Now, as it says here, this resets at the beginning of each month. So if you accept 20 patients in November and you have a monthly capacity rate of 20, on December 1st, it will reset to 20 because we're in a new month. How current capacity is reduced is as providers add patients to their panels. So if I, the provider, submit the $0 fee code to add this patient to my panel, the system is automatically going to lower the current capacity because we know this provider has attached patients. What that means is that this current capacity reduces no matter how a provider adds a patient to their panel, even if that patient isn't part of the Health Connect registry. And then the final piece of information is combined clinic capacity. So what this tells our attachment coordinators is across the clinic, how much capacity is there this month to accept new patients. And when I go through the intraclinic case transfer demo, we'll talk a little bit more about why that might be useful. So now I'm just going to navigate into the Provincial Attachment System. And really what I want to start with is showing you how your provider can give you access to be a panel manager. So only the provider is able to do this. your director, your clinic manager, someone else that maybe could modify this provider's panel is not able to update those permissions. Only the provider themselves can do so. And how they would do that is on the homepage where they see their list of clinics, under the clinic where they want to grant a person access. So for example, in Vernon Family Med Associates, I want to designate another team member to have panel manager permissions. What I'm going to do is I'm going to select this Manage Access button. Once I select Manage Access, by default, the system is going to take me to the Granted Access By tab, which really is going to show me who has given me access to modify their panel. So I can see that there's no one at the clinic that has given me, Justin Carswell, the permissions to modify or maintain their past panel. Where I want to be going is to the Give Access To tab, because I want to be giving access to someone else at my clinic. And in this tab, it's going to show all of the people who are added to the clinic. For information on getting added to a clinic, our previous webinar that we hosted 2 weeks ago reviews that. We also have multiple user guides that go through this process, specifically how to add and remove users. In this instance today, let's say that I want to give Jennifer Ann Bond the permissions to manage my panel and profile. Now, this could be because Jennifer Bond is a locum who's supporting my panel for me. There could be many other reasons, like I want to give my clinic manager access. But as far as the system is concerned, I, Justin Carswell, can grant anyone who is part of my clinic the permissions to manage my panel and profile. So to go through, you'll click this pencil icon. You'll check off Manage My Panel and Profile. You can click anywhere outside of that window. You'll see that it highlights to yellow, and I'm going to go ahead and click Save. As you're able to see, I can designate multiple people to be panel managers at once before clicking that Save functionality. So again, this has to be completed by the provider you support who would like to give you access to their panel. In every other instance, no one else is able to grant that permission for you. So now I'm going to jump into what you would see as a medical office assistant or clinic manager. So you can see the buttons are a little bit different here. I'm going to continue to use Vernon Family Med Associates, but you'll see that I only have one button at the bottom, and that's that Manage Access button. When I select that as a clinic manager or medical office assistant, I'm also taken to the Granted Access By tab, but you'll see that this is actually populated because Justin has given me permissions to be a panel manager. I'm able to see two main hyperlinks here. So the first is their panel. This is going to have their panel capacity information, as well as the list of all patients who are on this provider's panel at Vernon Family Med Associates. The other hyperlink, which we'll be going through shortly, is the pending attachments. So this is going to show the section where you can review all potential patient matches that have been sent to this provider by the attachment coordinator in your community. Now, before we jump into the whole accepting process, I thought it would be good to just chat about that panel capacity and how it's entered. So as a reminder of what we went through in our slides, the desired panel size and the monthly capacity rate are entered by you or the provider. Everything else is auto-calculated based on the actions that are taken within the Provincial Attachment System and via that $0 fee code. So jumping back into my screen. So I'm logged in as Kevin Green. I'm a clinic manager, and I want to update Justin Carswell's panel capacity. So I'm going to go ahead and click on Justin's panel. And this is going to take me to the My Panel page for Justin Carswell. Now, if we just sing the Jeopardy theme song while we wait for our training environment to load. Now, it's pretty obvious that I'm in a training environment because we have lots of people who have names without vowels. I won't try and pronounce this, don't worry. And what I'm able to see at the top, and what we're really going to be focusing on this time, is that panel capacity. So I can see that previously I entered a monthly capacity rate of 5 and a desired panel size of 800. And as we know, your current capacity and future capacity reduces as you utilize the system, so updates aren't required here. However, Justin has actually added an additional clinic day to his schedule, so his monthly capacity rate is changing. He's actually going to be able to accept more patients each month, and I want to be able to update that. So by clicking this edit button that you can see I'm highlighting in the top right-hand corner here, it's going to open up that edit screen. Now, my desired panel size for Justin is still 800. That hasn't changed with him, but as we talked about, he's added an additional clinic day. So now his monthly capacity rate is actually 10. I then have 2 action items here in addition to canceling if I've made a change in error. The first is to click save. And then when you click save, what it's going to do is it's going to save what you've entered. And then it's also going to do a calculation for you. So I can see that my current capacity was updated as a result. I can achieve the same outcome and close the window by clicking save and close. So the save button is good to see how it was auto-calculated. If you're confident that you've entered the information correctly, you can click save and close. If for whatever reason you clicked save and you need to change it, no worries. You can click the edit button again and make any changes that are required. Perfect. So now let's talk about actually reviewing those attachments. So we went through how a provider can give you panel management access. We also went through updating that provider capacity, which is excellent. And now our provider has been sent potential attachments to review. So I'm going to go ahead and navigate to my homepage here. And I would also like to go through what that process looks like. So again, I'm going to go to that Manage Access button. Now, this time, I actually want to be reviewing his pending attachments, right? So these are people who are not yet attached to Justin. They're potential attachments because he is accepting new patients. Now, if I click on that hyperlink, it's going to take me to our review pending attachments page. Now at the top, I'm able to see which provider that I'm in the pending attachment section and the clinic that I'm using. This is especially helpful if your provider works at multiple locations and you support them at multiple locations. Now by default, I'm taken to the pending selection tab. This is the first step in the patient's journey once they have been sent to the provider to review. And at this stage, there are some key pieces of information that can be really helpful in determining whether this patient might be able to move to intake or whether they just aren't a match for this provider or clinic. Now, the first thing I want to highlight is this sent to provider date. So as we went through a little bit earlier, we do have a 2-week benchmark to contact patients just because while a patient is pending with Justin, they're not considered for attachment anywhere else. So this can be helpful to see which patients I really need to review, like these ones that were actually sent to me 19 days ago. I'm also able to see the patient's HCR case number. Now, this is really helpful because it allows me to email back and forth referencing just the HCR case number. I don't have to worry about any sort of data breaches because this is not patient identifiable data. Only you and the attachment coordinator would be able to use this case number to actually reference a specific person. So this can be really valuable in those back and forths that you might have. I'm also able to see the patient's name, PHN, and date of birth. If the patient is part of what we call a family or group request, so a family that would like to be attached together, that field is going to populate. And just like with any of these except for the health info, I can sort them by clicking the column title. So you can see that I have selected it and now the group request or family request is together. Now I am in a testing and training environment, so complexity is not populated because we don't have hospital utilization or doctors billing data for these people because they don't actually exist. But in the real world, you would see high, medium, or low populated in this section. The last two can provide me some key information on what's going on right now with this patient's health. Now, I can see for these first three people, they haven't recently completed those health questions, but for the rest, I can see that they have. And if I wanted to see how they've responded to those questions, I would click this View Health button. And what I'm able to see is that this patient is pregnant or has recently given birth in the last 3 months, but they haven't been diagnosed with anything. In a similar vein, if I were to open this one, I can see that people can select an option for both. There is also a prefer not to answer and none apply to my health options for those where nothing is true or they don't consent. And that's exactly what would appear here. Now, let's say that Kim test here, Mary test Ellen Doe, and Madian are all actually going to be good potential patient matches. And so I want to move them over to the intake process. And actually, let's just take Harris over here as well. What I'm going to do is I'm going to click this Accept for Intake button. So what I'm saying is that I'd like to know more about these patients. We'd like to contact them and see if they might be a match. When I click Accept for Intake, I'm going to get a pop-up that lets me know how many patients I have selected and that they'll be accepted for an intake appointment. It is important to note that at this stage, they will be notified that a clinic will be reaching out to them to book an appointment. And let me show you exactly what that template looks like. So when a patient receives that notification, they get a subject of Health Connect registry, prepare for intake. You'll also note that we do not provide the clinic or provider's name here. We only say a family doctor or nurse practitioner in your community will be contacting you. And the reason that we say that is we know that there are patients who would receive this email and immediately pick up the phone and call your clinic, even if you don't yet have any intake slots available. So we've left it fairly generic. That way you can reach out when you have those spots or have the time to be on the phone, and the patient isn't aware exactly who it is. Now, what if a patient actually isn't a match? So I'm going to confirm these people. I'm going to move them to pending intake. But let's say that this person, whose name I'm definitely not going to be pronouncing, isn't actually a good match for this clinic. And maybe what it is that their complexity is high and this provider at this time just doesn't have the capacity to be able to support a high complex patient. What I can do is I can select that patient and any others that I'm declining for the same reason. And then I can click this decline button. Now, this is a new feature that was launched in end of September, early October. But what it allows is for the clinic staff and the attachment coordinator to be on the same page by default on why this patient wasn't a match for this provider. I want to highlight that these are specifically administrative reasons and will be administrative reasons only. Any sort of clinical decisions, et cetera, are outside of our scope. And so we just want to know about administrative reasons that might require further follow-up or matching by the attachment coordinator. So let's say in this specific example, my provider capacity has changed. I just can't take on a high complex patient right now. So I can select that decline reason from the list and I can go ahead and click confirm. Now, at this pending selection page or section, patients are not informed if they were declined. And the reason for that is we certainly didn't send them a notification letting them know that you're reviewing them. So we're not going to send them a notification letting them know that at this early stage they weren't accepted. The only time that a patient is notified at this stage is if I'm actually accepting them for intake and moving them over. Now let's pop into the pending intake tab. So these would be people that I clicked the Accept for Intake button. And you'll see that now that I'm in the pending intake section, there's an additional field that populates, and that's their contact information. So if I wanted to view Madian's contact information, for example, I can click View Contact. I'm able to see their email, their mobile phone number, their home phone if it was provided, as well as the address utilized for attachment. And at this point, I would contact the patient. Now, if you're contacting the patient and you're going to be booking them for an intake, whatever that process looks like, they should be in your EMR. What that means is that any sort of notes on, called the patient and left a message, called and booked an intake, etc., would all be stored directly in your electronic medical record, as when you're contacting the patient, they should exist in that system. And that's the reason we don't have a note functionality directly in here, is because all of that should be right in your EMR for you. Now, let's say that Kim here is actually going to be a better match for my colleague, Jennifer. So what we've heard is there are many clinics who would prefer that all of the potential attachments be sent to the director or a specific provider, and then the clinic themselves will determine who might be the best match for this patient. To help support that workflow and recognizing that patients might be transferred within a specific clinic based on their health needs, we've added a functionality called transfer. Now, when it comes to the review pending attachments section, what this means is I'm transferring a potential attachment to another provider in my clinic. This doesn't mean they're accepting this patient. It just means that they're going to appear on the pending intake tab for them. And what do I mean by that? So when I select Kim from the list here and I click transfer, I'm going to be shown a list of providers that are in my clinic that I can transfer this case to. So I can see Jennifer Bond here, who I talked about might be a good match with Kim. I can select that provider from the list. Once I click proceed, it's going to reassign that case to Jennifer Bond. And when she goes into her review pending attachments section, she's going to see Kim available in the pending intake tab. So again, this is not confirming attachment. Patients are not going to be informed of this transfer. It's just a way for you to change which provider in your clinic has this pending attachment to review and to complete the intake process for. So I'm going to go ahead and proceed. Kim is now going to disappear from my pending intake tab for Justin and will instead appear on the pending intake tab for Jennifer. Now, again, let's say that this person, whose name, again, I'm not going to try and pronounce, we weren't able to get a hold of them. Now, within the Health Connect registry, we have done a lot of work in contacting patients. So, for example, patients receive communication every 90 days asking if they're still attached, has their health changed, has their contact information changed, so they get that every 90 days. We've also done some work around when a provider submits the $0 fee code, making sure any cases that patient has are set to attached, but we recognize that not every patient is going to respond to those emails. Not every patient is going to be on the ball in terms of calling back and saying that they're attached or that their phone number has changed, whatever it may be. So in those instances where you're not able to contact the patient, when you click decline, that is one of the reasons that's able to be selected. So this patient cannot be reached, decline reason. If I select that reason, this case goes back to the attachment coordinator, just like it did in the pending selection. But what this tells the attachment coordinator is that before this patient is sent to a different provider, we need to make sure that all of their contact information is up to date. Now, again, there's lots of work that our HCR support team, our ongoing patient communications, as well as the system does to try and keep these things up to date. But when you have hundreds of thousands of people on a registry, unfortunately, we can't get them all. I feel like there's a Pokemon reference in there somewhere, but I'll move on for now. So I'm going to go ahead and confirm that this person who I cannot pronounce, we were not able to reach them. So I'm going to go ahead and click confirm. And again, that patient's going to be sent back to your community attachment coordinator to be contacted and then potentially sent to another provider in your community for a match. Now, our last option in this attach section is actually clicking attach. Now, this functionality works the exact same as submitting the $0 fee code. So what I mean by that is to acknowledge that an HCR case has been accepted and that this patient has been attached to this provider. You can either log in and click this attach button, or you can submit the $0 fee code. Both options are available and will achieve the same outcome. Now, throughout both of those processes, there is some information that's provided. So after that intake, when I've moved the patient to the pending intake tab and we've told them that we were going to reach out to them, when I click decline, the patient receives an email that says finding you a better match. The other one that they might receive is if that attachment was actually successful. So you submitted the $0 fee code or you clicked attach in the panel registry. In either instance, the patient gets a notification that their attachment to a provider at X Clinic has been successful. That concludes our demo portion for accepting new patients. Let me just open our slide deck and we can move on to PAS panel management.
Thank you, Tara, for that. Yeah, so let's talk about PAS panel management. So really wanted to just acknowledge the value and the benefits of the attachment ecosystem, so the provincial attachment ecosystem. And a lot of this, I'm sure you know or have seen in communication, but just to ground us again, is really the intention of the provincial attachment system to reduce administrative burden over time. We talked about those wait lists that used to be kept locally, those Excel spreadsheets as an example, aligning it to the payment models for providers and the technology enabling some of those pieces. We also needed the ecosystem to help our patients who may have been calling clinics all the way across the province over and over. Are you accepting? Going to social media otherwise. So from an equitable, centralized perspective, one place for folks to put up their hand. And while they're waiting and putting up their hand, which we know, again, attachment isn't tomorrow, 811 is here to support them with finding services in their community in the interim, or our virtual care team here. Again, supports that attachment piece. We did just moving to a digitally enablement solution, reducing some of those bottlenecks, making clinical administrative data available as part of the attachment process instead of needing to be collected by patients directly and or by clinics or communities. We were able to accelerate attachment in BC, and we've seen some really good responses in the attachment time so far as the Health Connect registry and PAS is concerned, as well as the data system and planning. So accurate information, really understanding where there's patient needs, where there's supply, where providers accepting patients, and making those connections where we can, and where there might be a gap that's too big, and what do we as a ministry and our partners, DOBC and NNPBC, need to do to rally around that community where they might need more so far as the providers are concerned, or clinics, and or more patient awareness as an example. And just that clear view, that really the line of sight that we didn't have before around how many clinics we have, how many folks are looking for attachment, how many folks are attaching. And I think it's worth noting as well that as powerful and beneficial as the provincial attachment system is concerned, it is a system. It's the people, the process, that technology and data, but in community, processes still exist. Attachment still happens organically in community. So this is really around enabling a system to support from that centralized provincial perspective, us being able to at ministry do some of the heavy lifting so our providers can get on with providing the care that we need them to provide. But we also recognize that while I may have put my hand up on the HCR or not, attachment does still happen in community outside of the provincial attachment system. And we're working to find ways to support that as well. I am, I'm a mom, I've got a new babe, and my doctor took my baby on as a patient. My parents moved in with me from another community, and my doctor accepted those patients so that my whole family can be attached in one place. Those things still happen. Those things need to still happen. But the provincial attachment system is around how might we, kind of from that global sort of centralized perspective, do more of the lifting so that those pieces in the community that still need to happen, there's time and space for that as well. So I just wanted to call that out for folks. Now, this ecosystem, the provincial attachment system and the people process technology data it includes, there are key roles, and I talked about a few of those beforehand. So far as the attachment process is concerned, 811, Health Connect registry support, our attachment coordination team across the province, but there's our providers, but there are two really important roles as well that I think are worth spending a bit of time on and really trigger these webinar series, and are glad that those of you who are in these roles are here with us today. And that's our medical office assistants and clinic managers. A lot of what we're looking at in this system, it takes a village to make it happen, and you're part of that village. And so part of this is really around enabling the MOA role in PAS, specifically to do that attachment piece, but to also support around the most responsible provider work. And so this is really around making sure that we find ways for the system and the systems and people to speak to each other, to be able to keep paths in a place that it is up to date and aligned with the EMR, but also ensuring that what you need to do directly in your community, in your clinic for your EMR, you've got the space and time to do it. So it's finding that really nice synergy of all the folks who might be able to help to make this work, and where we can get the system to do more of the work for us, like the provider capacity field calculations. Let the system do the math so we can get on with the attaching or the providing care. And specifically around the most responsible provider, which is going to be a key portion of what Tara will walk us through in the demo perspective. When we're talking about the most responsible provider, we're talking about the family doctor or nurse practitioner who provides regular longitudinal primary care for patients. We're talking about the longitudinal relationship that I as a patient and a provider have. And sometimes those relationships are incredibly long. We see patients through their life cycle, and they're incredibly important to healthful living. One of the things that the Provincial Attachment System has provided us when we collected all of the panels across the province for primary care providers is the opportunity to see where patients were attached to multiple people, or where providers believe that patient were on their panel and that happened multiple times. It's what we call like a panel conflict or an MRP conflict. We did a lot of work across the system to see where people were getting their care and how recently, and solidifying that and working with providers and clinics to resolve those conflicts as we could. But there's about 150,000 patients in BC. As you can imagine, this ebbs and flows a little bit as folks are attached and moved into the province and all of that, where they're sitting in conflict. In other words, that patient, me, I'm sitting on two panels. I'm sitting with two providers that believe that I'm attached in their panel. So there's a decision that needs to be made there. And the reason we specifically want to talk about this conflict, if you will, this MRP panel conflict, is there's a significant opportunity here, one, to get to clarity, a data integrity perspective, to truly understand, I am a provider, this is my patient, or I am a patient, this is my provider, in order to support that direct one-to-one longitudinal relationship. But as you can imagine, where that patient maybe isn't attached to the doctor over here, but instead to the NP over here, that might create capacity for somebody else to be attached to that provider. So we come at this from the perspective of both data integrity and accuracy, but also just the opportunity. 150,000 patient conflicts. If we could resolve those, imagine if we could attach 150,000 more people. And that's really kind of the honing in on the MRP piece here today, and why we wanted to bring it up in the role. And so with that, we'll let Tara get into the system and what this means and how that all works. Over to you, Tara.
Awesome. Thank you. I see a hand up. Any questions? If you just want to pop them into the Q&A, that would be fantastic. All right, so let's talk about panel management in PASS. So in terms of managing a provider's panel in PASS, we'll quickly review the panel capacity section just as a reminder. We'll talk about adding and removing patients. We're going to talk about most responsible provider, how to use that information in PASS, what actions may or may not need to be taken. And then we'll also chat about the different list views available to you to help you with all of the other pieces of information. So just going to navigate back to the PASS, and this time I want to be looking at Justin Carswell's panel. Now, to give us some meat on our bones, I'm actually going to be using Vernon Downtown Primary Care Med Home this time. And the reason for that is because Justin has an incredibly large panel at this clinic. So this is a great one for us to play with. Now, I can see my capacity information here. I can also see that my desired panel size is lower than my current panel size. What that tells us is Justin is definitely not accepting new patients. However, having a lower desired panel size than a my panel size is not going to, like the Health Connect registry and the Provincial Attachment System won't be able to work with you to get you close to that desired panel size. That's something that is independent of the system, but it does allow us to very clearly say that Justin doesn't have capacity. Now, that capacity information, of course, can be edited by clicking this edit button. But what about adding patients to this panel? So we talked about when we were going through our previous demo that you can click the attach button, or you can submit the $0 fee code. So that is how a patient gets added to your panel. So in the example Brandy discussed, where mom has a new baby and the provider has accepted that baby, they would submit the $0 fee code and the patient is on this provider's panel, all good. However, in order to remove a patient from a provider's panel, you must log into the Provincial Attachment System to do so. Now, if you have a specific patient in mind, you can do a partial name match where you search at least 4 characters, or you can search by a specific PHN, in which case it must be an exact match, all 10 digits. Now, let's say that I have found this patient and I want to remove them. I can select them and I can click remove. There are other instances, though, where you might want to remove a patient from a provider's panel, and that is really where MRP status comes in and our list views. So I have a duty as the provider's panel manager to review all of the patients where Justin is not their most responsible provider. Now, there's a really easy way of me seeing just those patients in here, and that's by clicking this drop down next to active and selecting not the MRP from the list. What this is going to show me is all of the patients that are on my panel where I am not the most responsible provider. So for Kenton here, I can see that I was updated to not the most responsible provider on October 15th. Now, this may have happened because another provider submitted a $0 fee code to attach this patient, or the patient used the patient choice page, which we'll talk about shortly, to say that this provider, Justin, is not my provider. Now, it is possible, and we'll go through this in a moment, that you see a patient where the status is not the MRP, but you or the provider believe that this is incorrect and that this patient is actually Justin's patient. Again, we'll go through it in an infographic in a moment, but if I, the provider, believe this patient is mine, I can submit the $0 fee code again. And as long as this patient hasn't said that Justin is not their provider, it's going to update it to confirmed. So again, to summarize, if you are sure that this patient belongs to this provider, you can submit the $0 fee code, which will reconfirm this patient with Justin, unless the patient themselves has specifically said that Justin is not their provider. There's another MRP status that I know we get lots of questions about, and that is MRP pending. So this is different than the pending attachments that we reviewed earlier. So pending attachments, potential attachments, those are people who are on the Health Connect registry, but are not part of this provider's panel. They might be in the future, but they're not yet. In this section, pending denotes that we don't know who this patient's MRP is. We know that at least 2 providers have claimed this patient as theirs, but through billing data, calculations, et cetera, we really just don't know for sure which provider this patient belongs to. Now, again, if you're confident that you know that Justin is this patient's provider, you can submit the $0 fee code, and that will reconfirm them. But what about when you're not sure? So one thing that we can go through is how we can help and really leverage patients to determine who the patient's most responsible provider is. So before we get really into this, this is only for patients who have a past MRP status of pending or not the MRP. And of those patients, it is only ones where I am not sure that I'm the MRP and I have not contacted the patient directly to do so. So let's walk through this. So as we just saw, I can review the MRP status for each patient in my panel. People who are confirmed, no action required, I know they're my patient. People who are pending, we are not sure, not the MRP, means that this patient's been confirmed with someone else. Now, in terms of actions, if I am certain that I'm the MRP for this patient, I can submit that $0 fee code that we talked about. If I know that I'm not the MRP for this patient, I can remove them from my panel like we just saw. In the cases where I'm not sure one way or another, the patient is pending, but I actually haven't seen them for a year, that might be one to follow up on. I could call the patient directly and ask, and then submit the $0 fee code or remove them from my panel, depending on what they say. Or I can ask the patient to visit the patient choice page or call 811. Now, we do have multiple user guides available in the Provincial Attachment System that review most responsible provider, including links to the patient choice page. The slide deck that we will be sending to you, as well as the recording, etc., does contain the links to those specific user guides in PASS. But to give you one last quick visual. So I have a patient who is MRP pending. I know they are not my patient. I can select them. I can click remove. Do I wish to proceed? Yes, I do. That patient is no longer on my panel. This will not create a Health Connect registry registration for them. That is not connected. So removing a patient is not going to re-add them or add them to the Health Connect registry. I am simply removing them from my list of patients that I have claimed as being the most responsible provider for. Now, we also have times where I, Justin Carswell, might be moving clinics and a couple of patients are following me. I can select those patients from the list, and then I can click this Change Clinic button. What this will do is list the other clinics that I am a member of. I can select that Vernon Family Med Associates clinic from the list. I'm going to go ahead and click Proceed. I do want to proceed, so I'll click yes. And now those 4 patients are no longer going to appear in my panel at the Vernon Downtown Primary Care Med Home, but they are going to appear on my panel at the other clinic that I work at. Now, there are other ways as well that a provider might want to remove patients from their panel without actually removing them. And what do I mean by that? So let's say that I am retiring or I'm moving, whatever it may be, and I need to transfer these patients to another provider. Now, lucky for me, another provider has been able to accept this patient, which great, awesome. That's what I'm looking for. What I can do is I can select the patients that this new provider is willing to accept. And then what I'm going to do is I'm going to click this Transfer Provider button. What this is going to ask me is to enter the MSP number, so the MSP practitioner number for this provider that I want to transfer the patient to. And the reason that we do that, again, is because we want providers to be having these conversations outside of the system. It shouldn't be a surprise that a provider is transferring patients to somebody else. That should be very clear and straightforward. So what I would want to do at this stage is I want to be entering the MSP practitioner number for the provider that I'm transferring these patients to. And then once I do that, it will allow me to select the provider from the list, and then I can transfer them over. That provider would then be able to review those transfer requests in the corresponding tab, and then either accept or decline those transfers. But again, the system functionality for that is to allow you to do that without having to remove and submit a $0 fee code. The conversation around transferring this patient to another provider should be taking place outside of the PASS long before the transfer button is ever used. This is really the administrative, not the FYI, can you take this patient for me? Just to fully summarize. Thank you all again for taking time out of your day to listen to me instead of sweet silence in between patient confirmation calls. We will be hosting both this webinar and the Access and Navigation webinar again in late January. You can expect to receive a flyer faxed to your clinic sometime early in the new year.
Thank you, everyone. And thank you, Tara, for the demo. Thanks all.
Thanks all.